For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hello everyone, and thanks for being here today. We have updates from the County of Santa Clara Public Health Department with regards to the quarantine situation and also with regards to the vaccine. Without further ado, we'll introduce Dr. Sarah Redmond to provide updates on the quarantine situation.
Thank you so much. Thank you everyone for being here today. I'm here to announce new COVID-19 quarantine guidance. This guidance takes effect immediately and is aligned with the California Department of Public Health's guidance that is also being announced today. This new guidance shortens the length of quarantine from 14 days to 10 days from last exposure for people who remain asymptomatic during their quarantine period. And this is both for those who have traveled and quarantine after traveling, and for those who have come into close contact with somebody who has tested positive for COVID-19. However, because somebody can still get sick as far out as 14 days after their last exposure, we still recommend that everyone monitor themselves for symptoms through the full 14 days from the last time they were exposed or from when they returned from traveling. This new guidance also recommends that people who are close contacts to a case of COVID-19 get tested on day 6 or later after their last exposure. If testing is done earlier than day 6, we recommend that people be tested again towards the end of their quarantine. Those who have symptoms should, however, get tested right away. At this time, healthcare workers and first responders are instructed to continue following existing guidance for early return to work considerations, and additional guidance for healthcare workers and first responders will be forthcoming. Right now, we're in a critical phase of our response to the pandemic, and especially as cases continue to increase rapidly across our region, we need everyone to closely follow these public health guidances in order to slow the spread of the virus. As we learn more about this virus, we will continue to update our recommendations in order to have the most effective and safe quarantine guidances in place. As always, we make these decisions in consultation with our public health partners, including the California Department of Public Health and surrounding state and local health officers. We encourage the public to continue staying up to date on the latest guidance. And more information can be found on home isolation and quarantine by going to the county's website at sccstayhome.org. In addition, folks can find information on testing, who should be tested, and where to get tested by going to sccfreetest.org. Thank you.
We'll now bring up Dr. Marty Fensterscheid to discuss the updates with the vaccine situation.
Thank you. Well, we are really thrilled today because we will be receiving our first 17,550 doses of Pfizer vaccine, and we expect arrival of the vaccine into our county this week. We are following the priorities that were determined by the CDC and the state, and we will be vaccinating healthcare workers as well as residents of skilled nursing facilities. Those are the two priorities that have been set by the CDC. This is only the very first, excuse me. This is only the very first allocation, and more vaccine will be coming over the next several weeks and months to eventually vaccinate everyone in our community. We also expect to receive 39,000 doses of the Moderna vaccine next week, and that will be pending the approval of the Moderna vaccine through the emergency use authorization process, and that will be next week on the 17th with the FDA. We have been working closely through this process with the providers in our community as well as a community stakeholders group, and that's to help ensure that information is shared back and forth, and we are getting information from the community as far as issues that have come up around vaccination or vaccination hesitancy. We need to remember, though, that for the next several months, as the vaccines become more available, we all still need to wear our masks, stay socially distant from one another, and not to gather. We are hoping that these vaccines will eventually spell the end of this pandemic, Let's all stay safe, however, and be patient while we wait our turn to receive the vaccine. Thank you.
We'll now go to question and answer session. We will start over here with ABC 7.
Hi, Dr. Marty. For the initial 17,550 Pfizer dose allocation that's coming this week, is the recommendation to vaccinate 17,550 people, or is it to do half of that amount and save the other half for the weeks to come for that second dose? Can you just kind of give some clarification on the expectation for that?
Sure. The issues around the clarification of whether the vaccine that we're getting is going to be used for first dose and second dose. The answer is no. This is going to be used just for the first dose. We have been directed that all of our allocations initially are to be used as a first dose for everyone receiving it, and then we will then receive the second dose of vaccine. So we will not be holding back half of the vaccine for those that have received a first dose. Those vaccines should be coming. And that just reminds me that all of these two Pfizer vaccine and Moderna vaccines require a 2-dose regimen separated by 3 to 4 weeks, depending on the vaccine.
Go to Caroline.
Doctor, who comes next after healthcare workers in skilled nursing facilities, and how do you make that determination?
The prioritization is done by the federal government, the CDC and its committee called ACIP, the Immunization Practices Committee, and that will also be confirmed by the state. So we haven't heard what the next priority groups will be, but we assume that after all healthcare workers and the people in skilled nursing and long-term care, that we will see a priority coming eventually for the frontline workers and eventually for the people over 65 and those with other types of illnesses, comorbid conditions.
ABC the area.
Dr. Evan, this is a question for you.
Thank you. Yes.
So with more than 2,000 daily cases over the weekend here in the county, some may be wondering why you're reducing the days for quarantine from 14 to 10. And does this also apply to people who have traveled more than 150 miles to get to the county, like people coming off the plane? Will they also be required to only do 10 days now?
I'll answer your second question first. Yes, this new change in quarantine guidance applies to both people who are quarantining because they traveled and to people who are quarantining because they were a close contact to a case of COVID. The reason for this change, especially now amidst this surge we're seeing, the largest surge we've ever had here in Santa Clara County, is that we constantly want to take into account all of the best science we have and find the balance between the benefit to safety of quarantine and keeping people from getting sick and the benefit of getting people back to work when it's safe to do so or back to school when it's safe to do so. And we feel the science that the CDC shared with us over the last several weeks, confirmed by the California Department of Public Health's review, tells us that there's a minimal loss to safety by making the change from 14 to 10 days, while there may be a benefit to getting folks back out into the workforce. But during that time, we do still ask people to monitor for symptoms because there is some risk of very late infection in that 11 to 14 day range.
We'll go to KPIX.
Yeah, so what is the specific recommendation? It is 10 days now and then a negative test taken on day 6 or afterwards. That's my first one. And then for some people, quarantine is a luxury that they just don't have. Can you talk to me about the quarantine shelters that are set up for people that either live with too many people in a household or maybe are homeless?
Sure. To your first question, the exact new recommendation is that anyone who has either traveled outside the county or who has been exposed to somebody who tested positive for COVID should quarantine for at least 10 days after their last exposure. And that is regardless of whether they have no test or a negative test during that period, as long as they don't have symptoms. If somebody does have symptoms, we ask that they both get tested right away and that they also test negative and be 24 hours symptom free in addition to that 10-day period. So we also finally recommend that that test ideally should fall during the last 4 days of quarantine, day 6 or later. To your second question, you make a really good point that quarantine is difficult. It is not easy to stay home when people have jobs to go to, school to go to, loved ones to care for. And that's why the county has set up very extensive resources to try our best to support people during that time. These are both financial resources for folks who may be at risk of losing pay while they quarantine, regulatory resources and enforcement in order to make sure that employers are providing employees with all of the supports that they're entitled to, and individual supports, things like food being delivered to the houses of people who can't leave, or assisting wherever we can with things like elder care or other supports. That said, we ask people to do the best they can to quarantine and stay safe during this period, even though we understand that that is a lot to ask of people.
One of the things you didn't mention specifically was hotel rooms for people maybe that were homeless. Can you expand on that part?
Sure. So the county has developed many hotels that we're able to use both for people who have tested positive, people who may be about to become ill because they've either developed symptoms or been exposed, or people who are otherwise unhoused and at risk of becoming exposed or being part of an outbreak if they're in a more confined setting. And so the county is proud to be able to offer this to anyone who has currently no place to stay or is at risk of losing their place to stay, in addition to many people who have already tested positive or who have been exposed. Further details of exactly that program is something Roger can help support you with later.
NBC?
Dr. Patricia,
All right.
2 questions. First, next week you're anticipating the 39,000, you said, right?
Yes.
For Moderna, that's
Yeah.
the FDA approval. Will those also be first shots?
Yes. So the question was 39,000 doses from Moderna coming next week. Will they be used for first shots? And the answer is yes. So we're going to wait for the second shot, which will be 3 to 4 weeks later. Then we will get the vaccine for everyone who received the first dose. Will get their vaccine later on when it's time for their second dose.
And it may seem mundane, but people are very interested in the process. Can you describe, I mean, this morning some flew into LNS. Can you go through walk us through the process of getting it out and then which hospitals or anything like that?
Yeah, so the vaccine is shipped directly from the manufacturer, and we've seen news reports all day today seeing the vaccine arriving at various places. It will arrive via FedEx, and we will get the vaccine at the in the public health department, and also it will be shipped directly to the various hospitals. Once the hospitals get their vaccine, then they have their process that they go through in order to provide vaccine to the hospital workers.
We're going to ABC7?
Sorry, I was asking which facility, sorry. Which hospital?
So all hospitals in Santa Clara County will be receiving vaccine. They have all registered with the state of California and have given their priority needs and the numbers that they will need. The first doses will not fulfill all of the needs of all of the hospitals on this first round, and that will happen over subsequent weeks.
Dr. Marty, of the 17,550 doses, how many are going to the DMC system? And is it safe to assume that the DMC system is going to receive the most number of doses of the initial allotment from Pfizer? And secondly, how many healthcare workers are there in Santa Clara County?
Okay, so all of the hospitals, as I was saying, submitted their needs for the numbers that they need basically to vaccinate all of their healthcare workers. And so Valley Medical Center, along with Stanford, Kaiser, and all of the other hospitals did. In the first round, we proportioned the vaccine according to the need and what we were given. And so that will occur subsequently with all of the additional recommendations that we are getting. We are also eliciting information and support from the community eventually so that we can be equitable in our vaccine and have some weight to the vaccine allocations according to the needs and those most affected in the community. As far as the number of healthcare workers, we have estimated there are approximately 130,000 healthcare workers in the community, and but all of those are not in the hospitals. About 70,000 are in hospitals, and the others are in other clinics and other facilities, such as dentists and other healthcare personnel. So they will eventually get their vaccine as we get more and allocate it accordingly.
NBC?
Dr. Raymond? Can you, last week we were down to just 31 ICU beds. Can you give us a sense of the picture now? And do you fear it's going to get worse as more families get together in Christmas? And is there a contingency plan? There was talk of moving some patients out of the county or opening a regional center. What are some of the contingency plans to deal with capacity?
So I'll defer to our information team to get you exact up-to-date numbers today on bed availability, as well as explicit contingency plans around providing patient care. Although right now, I think it's important for patients to understand that anyone who is ill is still able to get the care they need. They should still go to the hospital. They should still call for emergency response if they need it. To your second question, I do still fear things are going to get worse before they get better, and that's part of why we're in the midst of a stay-at-home order that is urging everyone to really minimize the types of activities they have outside their home and the types of interactions they have with as much as possible. In order to be able to respond to that, yes, the county has multiple layers of contingency plan, everything from supporting people during isolation and quarantine to supporting our hospitals and other clinical care settings in order to be able to make sure we can both reduce transmission as much as possible and meet the clinical need that we're seeing for our county residents.
Just getting back to my original question, any plans to open a regional center or anything else for that mean?
I don't have a specific comment on that right now.
So we've heard about outbreaks in group settings in care facilities, and homeless shelters, and homeless camps. There was a gentleman, and I don't expect you to know the specifics of this case, homeless, positive test, sick enough to be hospitalized as of Friday, and then discharged from that hospital back into a camp. Subsequently, the county did connect him to the hotel room. But I'm just wondering, is that an example of the system failing initially and then recovering, or how do you see that kind of scenario where someone who, just is homeless and is a known case and is discharged back into a setting where it could be spread to others without it seamlessly going out?
So while I can't speak to any specific case, I could say that the county has multiple layers of protections in place to prevent outbreaks of our most vulnerable populations, whether that be folks in homeless shelters or skilled nursing facilities or homeless encampments, as you described. One of those is before someone gets sick, helping to try to house folks who are unstably housed right now. The next is trying to spread people out who are in our shelters, both by using those hotel spaces and by creating social distancing within the shelters as much as possible. And then, as you described, we also have systems in place to identify people when they're sick and don't have a place to go. If they are leaving the hospital, get them to one of those hotel rooms as seamlessly as possible, or if we recognize somebody at home, trying to find them and link them into a hotel room as quickly as possible. While this system is working overtime to meet that need for everyone, we would encourage that anyone who needs that leave a message, because we have been able to get back to people very quickly if they leave voicemails for us. But it does happen sometimes that the line is busy when folks call. So if they're able to leave a message for us, yes, we're able to get back in touch with folks and get them into that supportive system that they need.
We have a final question for our doctors?
No, you do have one more.
I don't know if you'll be able to address this, but time and time again, even last Sunday, Calvary Chapel is having a bunch of hundreds of people there, many without masks. You guys have the authority to stop it. What's going on? That could be a super spreader event.
I will defer to our legal experts and Dr. Cody to talk about any enforcement or regulatory activity. I can say that the Public Health Department's response and contact tracing to be able to ensure everyone understands the instructions of the stay-at-home order and why they're so important to protect their health and has the resources they need to be able to follow those guidance. Those are things that we continue to improve every day and to work to provide for everyone.
Thank you to our doctors for their time. Thank you for the media for being here. And have a good rest of the day, and we'll provide more updates as we have them for you. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.